Welcome to Healthy, Fit, and Pain Free Pittsburgh. I am your host, Ryan Wade, here as always, joined by my compadre, Dr. Tyler Bordick.
What is going on, everybody?
That went a little bit longer than I expected. I didn't want to talk over you. So today, we are here today, again, with another episode of Doc Talk. Well, what?
What's
up? We're just making a lot of noises at this point. That's all you're going to get today. No, I'm just joking. We are going to go dive into the sciatica rabbit hole today. And, sciatica is a very misunderstood topic. I think there's a lot of confusion, not just misrepresentation or guidance. I think just a lot of confusion of just what even is that. I mean, think of people, they feel a pain in their butt, doc, and I think they just think everything's sciatica. Mm-hmm. And so we want to put an end to that, right? And not only that, but we want to start to uncover some truths, talk about what sciatica actually is, talk about the differentiations in it, if there is any, and, try to highlight what is it, just the truth about what sciatica actually is, how to improve it, and really just start to uncover what is the actual progression of what will make sciatica just put an end to it, right? Because I think this is something that kind of can linger on. Even when you think it's gone, it's not gone. And, we really just want to put an end to it for people and help you kind of get out of that pain and make sure that this doesn't become a lifelong issue for people. Yeah. So, Doc, maybe you just want to start off by telling us, like we said, people think they have sciatica, they just, anytime they feel a pain in their butt, but what actually is it?
So in sciatica, I always refer to it as kind of a garbage term, and I hate to use that, but really I say garbage term because it's really just a piece in this like big dumpster of everything else going on. So for instance, sciatica is, if you break it down, sciatic refers to the sciatic nerve, which sciatic nerve is this huge cord-like nerve that consists of L4 to L3, not that you guys really need to know that, but segments of your back, the base of your lower back, and it comes out and forms this cord that goes through your butt and then goes down your leg the whole way to the foot. Okay, so that's your sciatic nerve. Then the at the end of sciatica just refers to a pain or condition of the sciatic nerve. So, my biggest pet peeve is where I'll hear people say, it's just my sciatica, or my sciatica is acting up. And you're basically saying, it's my pain of my nerve that's acting up. Well, that doesn't really tell you anything. That's like saying, my headache's acting up. Yeah.
So, and just diving into kind of, if I can bring any kind of specialization to these kind of doc talks, I like to go there, right? But if I can bring anything to this, I think if people start saying my sciatica, right, I think that's an issue in and of itself. Because it's bringing stress to admitting that your sciatica is a part of you.
Yeah.
Right? And we talk a ton about identity and who we are and what we want to be and what we want to become and what is part of us and what is not become part of us.
Yeah.
And pain should never be a part of you.
Correct.
Okay? And so I think that's issue number one. If we want to address something, your sciatica is not yours. No. Right? We want to start to say that my knowledge about how to get rid of the pain that I'm having is something that I know what to do. And that's the purpose of this episode today. So, why might somebody get this pain in their ass?
Mother-in-law, I'm just kidding. No, but, and that's the thing, it comes down to so many different things. So true sciatica, if you will, it's really, there is a compression of the sciatic nerve somewhere, and that is causing that, that referring effect, that numbness and tingling down your leg. That is true sciatica. If you're not having that numbness and tingling down your leg, you are not actually having sciatica. If you are having that pain in the ass, then you are having something localized there that's typically muscle bound. Okay, so like typically, not to go down too far in the weeds of this, but true sciatica is, disruption of nerve maybe from a disc herniation. This is mostly acute. Okay, this is, in 5 years, you shouldn't say, oh, it's my disc herniation. Because again, you're making that your problem, and it's not. And that's not the case. It could be...
Before we go any further, because I don't want to start to pile confusion on top of confusion, can we tell people the truth about what is a disc herniation?
So a disc herniation is really just a protrusion or a sticking out of your disc, which is normal.
Sure.
It can occur in over 39% of the population who are asymptomatic.
Sure. I've actually seen studies where it says 80%.
Could be that high depending.
Okay.
But, researchers always mix this stuff, but
sure.
still. But yeah, so disc herniation, which again doesn't really mean anything. A lot of times what people don't realize is it's not actually the herniation that causes the problems, it is inflammation of that area that causes the problem.
Okay. And you're saying basically because there's a herniation in that L3, L4 area, that's causing the pain from the nerve that's coming from the spinal cord to shoot down.
Correct.
Okay, cool. Anything you want to add on top of that before we move forward?
Yeah, so and then other things too are like some sort of, I hate to use the term compression because it kind of puts fear in people, but some sort of like stenosis, so like narrowing of your spine can also do some things. But again, there's studies that narrowing is very common. It's usual. It's like wrinkles on the skin. Yeah. And so you're going to get that little compression too. So it's really hard to say if that's what's causing your quote-unquote nerve pain.
Yeah, we definitely don't want to fear monger. And I think just every time you approach this podcast, whenever you're listening, keep in mind that all of us, unless you're like Benjamin Button, like we're all getting older, right? And our body changes as we get older, and these things like inflammation and narrowing, that happens to everybody, and most people don't present symptoms, right? It's just a matter of when we do present the symptoms, we think that there is this much larger issue at play than really than what normally it may be. And so we're trying to put an end to this great fear among things that people, I think, make a bigger deal out of than they really are.
Yep.
So, can you tell us? I know that there's it's a pain in the ass, right? Quite literally. And what have you seen in your years of doctoring, right? That is maybe some different presentations of sciatica in pain people. Maybe just play on that a little bit.
Sure. So let's start off with what it's not. So a lot of times people will come in, and if you've heard of anything called like a piriformis syndrome, this is a big one that gets thrown out there. And the piriformis is just basically a muscle of your buttock.
Top corner of your butt, top outside corner.
Yeah. So what happens, a deep muscle of the butt, and what happens is, people will blame it for being tight, and that's what's causing their quote unquote sciatica. People might be having some sort of a hip issue that's causing them to walk a certain way or change a certain way they move, which might be causing pressure. And again, these are not sciatica; these are different presentations to treat that. We need to treat that area, or at least guide you to treating that area. Mm-hmm. I actually can't remember what the original question was now. I forgot.
Have you seen, in your years of doctoring, have you seen different presentations of pain in people? And if it's maybe divided by demographic, maybe that might help as well.
Sure. So true sciatica, acute sciatica, I should say. Typically, it's like age like 45 to like 65, something like that is where you'll see like true acute. And acute meaning that you went through some sort of accident that caused this. So that's like if you're moving that big couch by yourself in your house and you have a little spill, or even like a car accident or something like that. Maybe some sort of other trauma, a fall, like that stuff is what we consider acute. So there's that. There's there's other factors involved too, like smoking's a big one. Mental stress can cause that as well. We find that whenever we start getting wired and our nervous system just starts blowing out the gills, we become ultra sensitive, and so when we become ultra sensitive, the littlest pinprick can turn into a massive stab. Mm-hmm. So that's just other things to take into consideration.
Sure. So again, we're talking right now about sciatica and the misinformation or the misrepresentation of what it might be and what people are hearing about it. What might and I think a lot of misrepresentation of things like this, something that is obviously painful, but people know it's not going to end them, right? I think people go to their PCP a lot for them, right? And we don't need to continue to beat down PCPs, right? But we will if we have to. But if if they go to that person, to that doc, what are the traditional PCPs, orthos, telling their clients about sciatica, what it is, and how to treat it?
Sure. So a lot of times you'll hear they'll use things like stretches, okay, which that's always like the big go-to is stretches, especially if they think it's some sort of like piriformis syndrome or something like that. They're going to have you where you do this stretch where you lay on the ground, you bring your knee across the body to the opposite shoulder, and you pull. And I'm not discounting this at all, but that's always the go-to, and that's typically, from my experience, not the right manner to take.
Is it not the right stretch, not the right exercise, not the right theory in general?
I would say probably theory in general.
Okay. Tell us a little bit more about that.
So very few times if somewhere is angry, it needs stretched. Many times if you have like an angry muscle, it can be just the weakness. Mm-hmm. It could be, instead of you stretching your buttock, a lot of times we find in people that it needs to be stronger. They have, their quote unquote core area is weak, their buttocks are weak, and that's what typically leads these problems. They don't have that control of their hips and their pelvis like they should. Okay.
Now, when you start talking weak and tight, now you're getting to my area that I can actually talk about, right? And so I know from experience of years of training, people who are desk bound, right? The more we sit, I hate using the term that our butt is turned off because...
Oh, please, let me just jump on this real quick. Because you brought up a really good point that I was going to bring up. So, sitting, for a perfect example. So, the pure form of stretch is you sit, laying on the ground, like I said, and bringing your knee to the opposite shoulder. What happens when you sit?
Well, people think their butt turns off.
Yeah.
I think for the most part.
Yeah. So, like, when you sit, you are kind of already in that position. And people will say like, oh, if they have like, pseudo sciatica, as we'll call it, false sciatica for those who don't understand pseudo, that position should actually help because you are stretching. But a lot of times people, when they're sitting, they will notice those symptoms come on. Mm-hmm. And so, again, stretching is not quite the answer. So go ahead, your point.
Okay, so, yes. So what I was saying is that people believe that like their butt is turned off. I don't want to say your butt is turned off, right? Because your butt never turns off. Your muscles don't turn off and on. Yeah. But it is less. There is less neuromuscular activation at that point because you are not stabilizing your pelvis when you're sitting. Correct. Okay, you're not engaging your core. You're not engaging your feet or up and down the chain, right? So. Really what we want to do is we want to, and I think what you're starting to say is start to kind of get more of that neuromuscular activation, right? Which is to say that we need to engage our butt and squeeze it more, right? To make things really simple. So, so we were talking about, what are, traditional docs telling people when we were talking about the piriformis stretch, right? Now, you said I want to backtrack a little bit more before we kind of move forward because I want to clarify this. What you said, an angry muscle, right? Besides pain, what would you clarify as an angry muscle?
Typically, it's I would say it's a muscle that's kind of getting misused. Whether it's not getting used enough, so it's just not strong enough, or that you are just constantly putting it in a poor position to where it becomes quote unquote angry. So, for instance. A lot of times with posture, we find that, neck and shoulder bother people. And the reason for that is because, let's say you get in a big text position, okay? And you're texting for a long time and you're sitting. What tends to happen is that you start to get in this position where you start stretching muscles for a long period. Well, those muscles after a while don't like to be stretched for long periods. They get angry, as I said earlier, about that. So they start to try to turn on... So to say, they start to try to activate to try to get you upright more, and that's typically where like that pain comes from because it's kind of that tug of war that goes on. And it's kind of the same thing in this scenario is where like it's not that your piriformis needs stretched or even like your buttock muscles or anything in general. It's not that it's just that you have put it in a bad position for a long period of time that it needs to get or a insufficient position for a long period of time that needs to get out of.
Sure. And I like to use the example, and this is extremely rudimentary and not as simple, but I like to use the visual of like, we always tell people, whenever you are warming up or stretching, like picture your muscle as like cold pizza dough, right? And you stretch it out, you stretch it out, you stretch it out. When we make muscle stronger, the actual like, the girth of the muscle, it gets, I don't want to say larger, but stronger, right? It's more reinforced. Thicker, sure. Okay, and so, if we're stretching and we have a weak muscle, it's not as thick, right? And we're literally, stretching means pulling the ends, right? It at a certain point, that pizza dough will rip, right? And your muscle's not going to rip by stretching it, right? But the point remains that a thicker dough would not do that, and maybe more effective, right? So I think the issue that we're running into and why we're highlighting this point is because the docs that we're talking about, I think, are most often prescribing stretches to people with weaker muscles who are having more inactive lifestyles, sitting more, don't have the buildup of glute that we would like to see. And it may be this prescription of exercise may be more effective if they had more strength.
Yeah. And, it also comes down, and it's not even, let's get away from the pure forms. It's everything. It can be anything from people having like lateral hip pain, so like pain outside their hip, even like from where their back meets their pelvis, like they'll have pain there. They might have pain in their hamstrings, and everyone just kind of classifies this completely as sciatica, and that's not necessarily the case. And the other problem too is, the one thing that some docs or people like to do is in the medical community is you'll say like, well, it hurts when I do this, and then they'll say, well, then just don't do that. Well, that's great and all, but if only life worked that way, if we had a bill come in the mail and you're like, well, this bill is going to drain my bank account, and someone told you, well, just don't pay the bill. How does that work out for you? It never does. What you need to do is you need to either reduce the bill or you need to make more money. And it's kind of the same thing here. It's like, well, don't do that. Well, no. How about you either like become more efficient or become stronger, or everything combined to where you can do that movement without pain?
I love it. I love that example because I want if you're listening, I want you to think about, right, like your sciatica or the pain. Sorry, I'm not going to use that term. The pain coming from your butt, right, is quite literally the bill, right? It's not always fun to get a big bill in the mail, right? But the same reaction happens when you feel the pain, right? That is the bill. Now, the bill collector man who's going to come get his money is an injury.
Yeah.
Right? And so if we don't pay the bill by doing the correct exercises, getting stronger, creating a system of healing, the bill collector man's going to come and get you. Right? And so we're trying to save... He gonna get you good. And we're trying to save people from the bill collector man getting them good. So, Doc, where do you think most people feel misled in this, this realm of finding answers for pain? I know last week we touched on arthritis and how there's so much confusion. Is it the same? Is it different? What are maybe some differences between sciatica and the total continuum of like other injuries that have a mass confusion around them?
Sure. Well, for one, when it comes to like true sciatica, it's really, and this is quite a rabbit hole in itself, but it's really trying to figure out what the correct diagnosis is. Because if you are someone who has an acute herniation from some sort of like, a trauma or something like that, well, that's a completely different story. Like, sure, we approach that a completely different way. But, a lot of times, they say, again, going back to our prior example, they say, well, just rest. Don't do anything. Well, rest comes with a cascade of other things. For one, we're seeing now with people not being able to do as much depression. Like, depression went through the roof. Obviously, if you're not doing as much activity, you're probably going to gain some weight. You don't have a stress reliever. You become weaker. Just kind of all these things, and then it's a lot easier to sit on the couch and watch Netflix for 3 hours and learn about Epstein case than it is to actually, go out and walk for an hour or ride a bike or run or whatever.
Rest is usually done on your ass.
Exactly.
At least the best forms of rest.
Yes. And so we're going to add insult to injury here, pun intended, to, and that's typically what they want you to do. Another thing, again, we'll go back to this from last week, is medication. If there isn't really an inflammation there from an acute injury, then medication is not going to do anything for you. It might, depending on what they give you, it might calm you down so much and make you sleepy that you feel a little bit better. But, so do drugs and alcohol, and are they really solving a problem?
Sure. It just basically, throws a blanket over top of the issue.
Yep, exactly.
Right, and all you got to do is take the blanket off. Right, so the issue still persists if you have the medication. It's just going to hide the symptoms, much like ibuprofen or something else, right? So,
Correct.
if you're going to go that route, might as well go that route. Can you just, tell me where, I know so many people that I've worked with have had just so much frustration of, I do what the people tell me, right? I do what the doctor tells me. I do what my trainer tells me. I do even what my PT tells me, right? And it was good for a little bit, and it comes back.
I was not that PT, by the way.
Okay, fair. But what do you think about, or what do you say to those people who say, sciatica, I've dealt with it, I've done my best, I actually did put my best foot forward to try to do right by my body, and it came back, right? What's the issue there, and why does that happen?
So, yeah, and that's, a lot of times, like if someone comes to my, in my office, the first thing I typically ask is, so what have you tried before? And, they'll go down this laundry list things of like, well, I've tried these stretches. Well, we've already debunked that of why that doesn't work. I've tried to, I've rest. Okay, well, that didn't work. Well, my doctor, my doctor prescribed this. Okay, well, that didn't work. And I went to this chiropractor and he did this adjustment to me, or this PT that did this adjustment. Well, research shows that adjustments don't typically happen or don't typically work. And so it's really I luck out in that fact because it weans out all those things that didn't work. Because really what it comes down to is we just get a bias in our mind. We get a bias in our mind that we can't do something. We wake up every morning and we're gonna wake up, we're gonna wake up in pain. If I try to do this around the house, I'm gonna have pain. If I go to work today, I know I'm gonna have pain when I do this. And they almost, become a slave to this condition, and then they go down this rabbit hole, becoming depressed. They stop, they don't do as much, and then eventually, like, they just get stuck in a pattern. I always say, like, getting out of a pattern is the biggest starting point. I hate to say there's a lot of PTs, but patients will go to a doctor will give them a script, they'll go to their PT and give the script, and that PT has to follow that script, or else that doctor gets mad at him, and then they lose a referral source. And so it's really challenging and questioning, like, well, maybe this isn't it. Let's actually look at you. Let's actually get you moving. If you're someone who likes to garden, but that's a problem, well, let's get you in those positions and see where the problem might be. If you're someone who likes to bike, and biking seems to give you, that hip pain and that bike pain, well, let's actually watch you bike. Let's actually watch you do the things you love to do and figure out where the discrepancy might be and then solve that. Instead of trying to solve the diagnosis, let's solve the things around it.
Sure. I just want to backtrack and hit on one point because it's the underlying cause of why we're here talking today, doing business together, why we treat people the way that we treat people. Did you just say that a PT will treat somebody differently because they'll lose money if they don't?
Mm-hmm. Yeah.
Can you reinforce how that went, just so people understand this process? Because I think so many people think that their insurance is out to save them, when in so many cases that I see, it is not the case that way.
Well, yeah, I mean, I know from the old settings I used to work at as a PT, you're kind of under this lock. You're kind of under this arm lock from insurance companies. And then even some, I'm not saying all doctors are like this, but some doctors, they would write you the same script over. I remember one time, this guy wrote on the script exactly what he wanted me to do. And this was, he was an old school doctor. He didn't keep up with research. He, was very stuck in his way. And there was one time I knew exactly what this was, just gave like a picture perfect presentation. And I did, and I treated that person the way they were supposed to be treated. And, within 2 weeks, they felt better. They were like pain free. They felt amazing. They went back to their doctor, told their doctor what they did. The doctor called me and berated me over the phone because I did not follow his script. Mm-hmm. And so, and then what do you got to do? You got to schedule a lunch with that guy to kiss his ass, and try to perk back up to him. And, insurance companies the same way. You only get reimbursed for so many different things you do with them. You only have so much time. And if they don't believe that stuff is billable, then you're not going to get reimbursed for it. And so this is something that goes through not just PTs, but a lot of healthcare providers' minds whenever they're treating you, and it's tough. It's very tough in this world, and I'm not coming down on them for that, but this is kind of the scenario that we're in nowadays, and you can't think that you're going to a provider and they're going to give you the best possible care.
Yeah, it's a shame.
Yeah.
Right, and we're not saying that it is this. And again, I just want to clarify: this is not the case 100% of the time. Unfortunately, is the case more often than not, and something that just shouldn't be happening in the healthcare field, for my money. Right? Mm-hmm. For what it's worth, I don't believe that it should be happening ever at all. And so that's why we do believe. Now, I'm not going to say that we don't work with any insurance companies, because we do on occasion work out of network. But this is why we believe that cash healthcare is the future. Mm-hmm. Right? Because I think at the end of the day, and especially now, and I'm going to say it in these unprecedented times, right? God. Especially now. No! Now, even more so that people want to, they're going to want to stay on top of their health, and the care for the individual will be top priority, because frankly, people don't have the patience for the bullshit anymore, mm-hmm. right? With everything that we've gone through, I don't think people are going to have the patience to not be treated to the highest level that their treatment should allow, not their insurance or their dollars or their status should allow. Mm-hmm. And so, I think that's just in a nutshell why we believe that cash PT or cash pay out of pocket healthcare is the future, right? Because you just get the treatment that you deserve, and no questions asked. You don't have to. Your doctor, your PT does not have to jump through the hoops to be able to appease the people at the top of the food chain to be able to do that, because you're getting the care that you deserve from the base level. And so we talked about a lot of stuff today, Doc, and the biggest thing I think is that we try to do here is provide people with actionable advice. Now, I will say that we have a special presentation coming up to follow up with this podcast Tuesday, December 15th at 2:30 p.m. inside the Healthy, Fit, and Pain Free. And in parentheses, it says after 50, 60, and 72. But it doesn't matter what your age is. Please join us in the private Facebook group that we have. Search us and answer the questions. We'll let you in. We're going to go live, or Doc T is going to go live on Facebook Live on Tuesday the 15th. That's actually next week, depending on when you're listening to this recording, as we're doing it today on the 10th. But at 2:30 p.m., you're going to be going live inside the Healthy, Fit, and Pain Free group on Facebook, Pittsburgh, to talk to people about how to treat their sciatica through building strength. Mm-hmm. Right? And through making your body stronger, more resilient, and put it in a more advantageous position for you to live a healthy and pain-free life, which is what the group is all about. Now, what can we tell them today about, maybe tell them what they can expect to see and how you go about treating majority of cases of sciatica? Obviously, everybody's different and gets different variations, but tell us what to expect out of that Facebook Live, as well as, what is your system and what your beliefs of being able to treat this condition?
Sure. So again, it kind of comes back to what I said earlier about patterning. If you're using the same patterns and you're getting the same results, then get out of that pattern. So that's kind of a big thing to start off with. And that's whether if you're someone who, sits at a desk, if you're a truck driver, someone who drives a lot, someone who takes very long poops, just anything of this sort.
I feel attacked.
Me too. Personal attack on myself. But anyhow, if you're stuck in this pattern, that's what's causing the problem, then you need to get out of it. So really, it's just about getting stronger and again, breaking your, again, if you're someone who sits, that muscle's already stretched all day. It's about, getting it out of that pattern, making it more stable, making it stronger throughout your day. And really, it's about resiliency too. You need to be doing things that's challenging your body to be more resilient so that it can take the tasks throughout the day. If you're someone who's sedentary and then you have to get up and, move furniture a day or even put up Christmas lights recently, you might not think that that's that strenuous, but one of our members here today was all excited because she's now strong enough she can put up her Christmas lights in one day and not have a single ounce of pain or have to take a lot of breaks. And why? Because she built up her resiliency, and that's what you need to do as well if you plan on interacting throughout life. And also just getting your shit together. And what I mean by that is getting yourself in a good place, getting your improving your happiness. And we're not going to get on this rabbit hole, but just getting your mindset right to where you're not going to let this type of condition rule your life or rule you, but it's going to be something that you gain control over and you create your own answers for.
Awesome. Cool. Doc, I don't think I forget to do this quite a bit at the end of the episode, so I don't want to pass it up. How can people get in touch with you personally? I know you answer quite a few questions when you have the opportunity.
Mm-hmm. So I'm on Facebook and Instagram at dr.tyler _Bordick. So you can reach me on all of those platforms.
Bordick. I spelled it wrong for about 6 months.
Yep. A lot easier to spell wrong than what people think.
Okay.
Yeah, and then you can also get me on LinkedIn at Tyler Bordick. So, and that's really it as far as how you can get a hold of me.
Awesome. So, little recap. Doc T is going to go live on Facebook Tuesday, December 15th at 2:30 p.m. inside the private Facebook group that is Healthy, Fit, and Pain Free. It says after, in parentheses, 50, 60, and 72. You can be any age to attend this and to join the group. We just like to emphasize because people think that whenever we say over 40, it doesn't mean 50, 60, 70, right? So, but it does. And we will be in there one more time, Tuesday, December 15th, 2:30 p.m. Join the group. We'll let you in. You can attend the webinar, and we will see you on the other side.
Bye, guys.